So I'm going to be doing a medication administration, oral administration. So first thing I would do would be go to the medical record and check the MAR, which is the medical administration record. So we have a patient, Thomas Potter, with a diagnosis of UTI, medical history of dementia, UTI, and rhabdomyolysis. So there's no known drug allergies, and the patient has two orders in the system. So one amoxicillin, which is 500 milligrams, POQ 8 hours. Administration times are 6, 1400, and 2200, and the order says it's valid until discharge, and the date is current, so that's okay. We're also looking at another order for acetaminophen, 650 milligrams, POQ 6 hours, PRN, for a temperature of greater than 101 degrees Fahrenheit, or for pain. And then you also have validity through the discharge by the physician. So I'm going to go ahead and pull the medication. So I would have a med cart. I would pull the medication. So I'm going to be pulling 500 milligrams of amoxicillin. So I'm going to check the correct medication, the dosage, and the date that it's not expired. And then I'm also going to verify that with the MAR. So that's okay. And then I'm also going to check the acetaminophen. Oh, that was the amoxicillin. This is the acetaminophen. So then we're going to go ahead and check, make sure it's the right drug, the right dose, and then the date is not expired. Compare it to the MAR. Everything looks appropriate. So then from there, you're going to go ahead and get your medications in the little cups. You're going to get some water for the patient, and you're going to get one of these little baskets to make things easier. Take it to the patient's room. So you're going to go to the patient's room, perform hand hygiene. You're going to go in, you're going to introduce yourself to the patient. You're going to explain to them what you're going to be doing. So, hi, Mr. Potter. I need to confirm your name and your date of birth. So you check the patient identifiers. Okay, Mr. Potter, date of birth, 8/5/1930. Perfect. So then you're going to go ahead and explain to the patient what you're going to be giving them and why. So you can confirm with the MAR at this point too. So this will be your third check. So, Mr. Potter, I'm going to be giving you amoxicillin, 500 milligrams for your urinary tract infection. And then you put it in the cup. And I'm also going to be you're going to be checking that everything's confirming with the MAR as well, one more time, for each medication. So I'm going to be administering you also acetaminophen, 650 milligrams, for your temperature of above 101, so you have 102 temp. So we're going to go ahead and give them. So you would administer medications. So if the patient needs assistance, you can assist them, but he doesn't, so he just takes them. So he takes them with good effect. You're going to wait with the patient and have them maybe open their mouth, stick their tongue out, just to make sure that they didn't pocket the pill. You're going to make sure that it went down. You're going to let them know that you'll be back in maybe like 15 minutes or so, just to check to see if there's any adverse reactions. You also want to give the medications within 30 minutes of the time that was specified in the order. So for instance, the amoxicillin, you can give it 30 minutes prior or after, 6 o'clock, 2 o'clock, or 11 o'clock. And so there's no abnormalities at this time. The patient tolerated it well, so you're going to go and chart what you found, what you administered, and then when you come back, you're going to see if the patient had a good effect from the medication or if there's any adverse reactions, and then you go from there. That's it.